Go ahead and introduce yourself. What is your name and who do you work with or who do you volunteer with?
I'm Bill Wood, and I'm still working full-time. Work for Cromwell Solar here in Kent in Lawrence. Been there since 2014. Previous to that, I was a county extension ag and 4-H agent for 34 years. I got involved in NAMI several years ago and have been involved with them since. And then also I got involved in Justice Matters on the mental health research team about the same time. And I thought, we need NAMI to go along on this trip with us in getting a crisis center in this community. And so I've been involved in the NAMI since. We call it a steering committee. We have 10 people on that, and I'm the chair of it. We have folks from family members, those that are living with a mental illness, and it's just a couple of them in the community that like helping. So we've got a kind of assortment of people involved. Health involves the whole body. We sometimes kind of compartmentalize what physical versus mental health, but we're all one body. We all work together. Public health is helping people to achieve the best life they can. We're all human. There's different times when we might have a broken arm or we might have depression throughout our lives, and if we've got some help that can help us get through that and help us overcome it, that's part of public health.
Yeah, so my name's Kevin Joles. I'm the Division Chief of EMS here at Lawrence Douglas County Fire Medical. I've been here for just a little bit over 5.5 years. My first role within the organization is essentially overseeing all medical protocols, anything that touches the medical side of our jobs. And so that means that all the ambulances that cover Douglas County, essentially not just the city of Lawrence, but the entire county, and all the first responders that respond to those calls, whether they're paid or they're a volunteer organization. So we help ensure that everybody's trained medically, they're certified medically, and that they're following the gold standard of the protocols that we put in front of them with the medical director. Somebody has to be doing it. It doesn't always meet the same business goals as some of the money-making industries that we have to have within a city or a county. So utilities are money makers for the city and the county to be able to produce infrastructure that maintains a good quality of living. The public health side of thing is when you don't have healthy people, we don't have good, vibrant workforces, we don't have people contributing to society as well as we could, and so it takes a toll on us. Working together, hospital systems, EMS systems, public health systems together, we do see each other on the same meetings over and over and over again. Even though the title of the meeting or the time of the day may be different, we're all still working together with the common goal. We found a lot of success in Douglas County because a lot of folks don't like to think we're on an island, but we kind of are away from some of the metro areas. And so we have to find our own answers, and we've been able to do that really well. Specifically, the drive-through vaccine clinics that we were having, that was probably one of the most well-run machines week after week after week, providing so much positive feedback from the communities that we were just blessed to be able to create something on our own without help from the outside nearby agencies.
Okay, hi, I'm Derek Rogers, Director of the Lawrence Parks and Recreation, and we have now included arts and culture into our department under Unmistakable Identity. A lot of what we do is for the health and wellness of the community, and as a team, we collaborate and work well with many partners, both internally and externally in the community, to ensure the health and wellness and safety of the residents of Lawrence. Initially, when I first started thinking about public health, this was pre-COVID, we didn't have much interaction. And then as soon as COVID hit and we stood up to incident command and we started looking at the health and wellness of the whole community, we were heavily involved with the Lawrence Douglas County Health Department, Dan Partridge, Dr. Marcelino, Dr. Scrimshire, and Sonia Jordan, as we worked through many things, in some cases on a daily basis, of how can we keep the community safe at the same time provide health and wellness opportunities. Initially, with our interactions with Lawrence Douglas County Public Health, it was basically how do we deal with shutting down our facilities to protect the population from the COVID-19 spread. And then as they evolved and we could start to open up some of our facilities and vaccines started to come online, we were working and coordinating with public health on facilities where we can help them distribute their shots, which tend to be the community centers, rec centers, and the depots. Later it evolved in as we developed color-coded opening guidelines and recreational guidelines for using our facilities. We ended up helping and working with Public Health Department to develop those guidelines for all of Douglas County. And I'd say our work with the homeless and the houseless population really began about the time COVID kicked off. When we started closing facilities where folks that don't have a place to live would go to the libraries, they would use our rec centers, our community building for showers, for restrooms, for places of warmth when the temperature got really cold or cooled down in the heat of the summer. So in its infancy, when we first began and the facilities closed, we saw that there was a need within the community for more outdoor restrooms, porta-johns, within the community for the houseless population that were particularly near the downtown area and along the Kansas River. And then as it evolved, we still couldn't use our indoor facilities, so we improvised and looked at our outdoor swimming pool that had showers and abilities. And that's where the staff really shined, I think, where how can we be flexible? It's not their skill set. Their primary job is, I signed up to be a recreation professional, I signed up to be a parks specialist professional, or a assistant golf pro. But they came together, they figured out a way to make it work, to keep everybody safe and do social distancing. And then that evolved as we went through the summer and it started to get cold into what can we do to help the homeless population. And then that's where we worked with multiple community members, the partners, the Pinckney Neighborhood Association for the Camp Woody tent project, pilot program. We worked with internal city departments, and that was truly collaborative between the county, multiple community support agencies to pull this together and have the support of that group in a very limited opportunity to do that. That helped get us through the first winter. It evolved into the second winter where, again, entering into a totally new space for the department, using hotels to help support the homeless through the winter as a winter emergency shelter operations. And then later it evolved into the winter emergency shelter that we used this year too. So as we did that, Winter Emergency Shelter is now supported by a Housing Initiatives Division, yet we still have the facilities, which in any emergency, I think the city and county will look for Parks and Recreation to use those facilities as needed to help support the community. When Dan Partridge notified us that we had been selected as the organization to win the Healthier Together Award. It was a little shocking because this is what we do. We help people stay safe, healthy, and keep them well. The staff of Parks and Rec is a very humble group. They're civil servants, community servants. So yes, it was a pleasant surprise, and as a department director, I'm very happy to see our department recognized for all they've done and continue to do to support the community and keep everybody healthy and safe.
You know, it's good. We're in a unique position within the fire department, Lawrence Douglas County Fire Medical as a whole. We do fire and EMS, and we do a lot of EMS. And in order to do that, our county partners are what makes that happen. And so the county administrator and Sarah Plinsky and obviously Joe Joliker have been very influential in being able to push us forward and allow us to do what we want to do. With their trust, we're able to produce a lot of good, positive things. We're aggressive and progressive in not only fire, but in obviously within EMS. And so their support has been great, as well as obviously our partners at Public Health, being able to do all of the things that we're able to do for the community together. I feel terrible even naming names, but there are so many people. I will get in trouble if I don't name them all. So I will just say it's a huge group effort. It's always been a group effort. We can't do it alone, and even though we want to, we just can't. So we appreciate everybody's help. I appreciate it. For those who nominated me, obviously they either got tricked into just coming up with the last person they could think of, but it's humbling, of course, because I might be a one-person EMS division here. There's still people within this organization that help the day-to-day happen. And so it's nice to be recognized, but there's obviously recognition that needs to be given to, we have 153 members here, so recognition needs to be given to them, Public Health, as well as all of our partners within the community. So it's nice to be able to be recognized for that, but it really is, it's a group effort. I would be remiss to not accept that.
I knew that I had been nominated by one of our board members, Marcia Epstein. She says, I know you normally wouldn't want any kind of recognition, but hopefully it would help expand the number of people who know about NAMI and what we offer. And I said, if we can do that, I'm willing to do it. I'm very thankful that NAMI gets some recognition. Some of the people who made a difference in my life, of course, is one, my wife. She got involved with NAMI first. Then, like I said, Marcia Epstein has been on our board, and I've known Bob Troyansky, who's a champion for mental health. And so he was encouraging throughout this process of growing and learning. And I tell you, when that crisis center gets open, I'm going to be dancing and shouting and crying out in the parking lot, because we worked for that since 2015. A lot of people in this community. There's numerous, I could list a long list of people that are making the difference in this community for mental health.